Alright, this is OR Hovermatt training for Rush University Medical Center. So we have our Hovermatt here. The Hovermatt is an air-assisted safe patient handling device that's fully breathable and it is disposable. So it's a single patient use device. There are thousands of microporous holes on the underside. We hook up an air supply or blower via a hose connection. It's going to lift the Hovermatt up with the patient on it, create this hovercraft effect, and essentially reduce the patient's weight by about 90%, making it way easier to laterally transfer, boost, even prone the patients. So the Hovermats themselves come in multiple sizes. Typically the OR is going to stick to our full length 34-inch wide. We do have a 39-inch wide and a 50-inch wide. All of them are the same length, and all of them have a 1,200-pound weight capacity. We always just want to ensure that the Hovermatt is wider than the patient so it can properly cradle them and lift them up all the way. We do have an alternative option for cases where we may be dropping the leg section of the OR table and we don't want this extra length of the Hovermatt to get in the way. That would be the half mat. It comes in some different packaging so it's identifiable in this yellow package. And the half mat is kind of a 3/4 length mat that would be used for those cases where we're dropping the leg section of the table, knee scopes, cysto cases, maybe GYN cases. As long as we're not going into steep Trendelenburg or extreme positioning, it is a friction reducing device, so we just want to make sure that we're not doing any steep trend or extreme positioning with these devices. So the half mat comes in a 34-inch width and a 39-inch width, and the weight capacity is 600 pounds, 1,200 pounds on the full length. When we talk about placement of the device and how we get this set up and ready for use, typically we're going to start this on the OR table because about 90% of the patients will be able to help assist in moving themselves onto the table. If we do have a patient that's very heavy or dependent, we can actually start the device in pre-op underneath the patient, as long as we make sure that when we come to the OR, the patient is nice and centered on the device, and we have to be extra careful if we're transferring onto the OR table. Since it's so narrow, we always want to provide a nice backstop and be nice and controlled when we're transferring patients from one side to the other. It's also ideal that we have a fitted sheet on top to protect the Hovermatt, or we offer the hover covers, which is a full-length impervious cover, highly absorbent on top, so it can absorb a lot of fluid and just protect the Hovermatt and keep it clean. This is definitely ideal so the Hovermatt can travel with the patient onto PACU, where it can be used for boosting or other uses, and potentially onto the floors as well. When we talk about the Hovermatt itself here, again, we just always want the patient centered on the device. We always want a little bit of the Hovermatt showing north of the patient's head so the head is fully supported. We also have safety straps here. It's important to make sure that these straps are nice and loose. The mat's going to blow up about 6 inches, so we want to make sure they're nice and loose and they're not constricting the patient when we inflate. We also have handles kind of circling the mat. They are color coded based on the width of the mat. So red would be 34, green for 39, blue for 50. Again, typically the size that you're mostly going to be using is the 34 or 39 if we get wider patients. When we talk about the air supply here, it would just plug into a wall outlet that sends power to the unit. We don't have to turn it on. Snap on the end of the hose, and once we connect to the device, we are going to inflate, starting with the adjustable speed button. We'll hit this twice. It can go up to 4 different inflation levels, but it basically shows whether the patient is centered or not before we lift them all the way up. So it comes up around the patient and cradles them, and we kind of have a feel for how centered they are. Then we're going to hit one of our 2 full inflation buttons. If it's the 34-inch, we're going to hit the green button. If it's the bigger mats, we'll hit the maroon button. And then to shut off the device, once we're done transferring or moving the patient, we would just hit the standby button, which kind of looks like the power button on your remote. So we're going to bring our patient in here and have her lay down nice and centered, and then we'll hook up and show you this transfer. So I'm going to go on the port here. We're going to angle towards the center. There's a snap on the inside. I'm going to line up the snap on the hose and on the mat and Velcro over the top. We're going to get our safety straps buckled in here. And it's important when we're doing our transfers here that we're nice and smooth and controlled. One thing we like to do is kind of push feet first, opposite caregiver starts pulling, and then we push and pull together to complete the transfer from there. Again, once we're done, we're just going to hit the standby button to shut things off. So I'll go ahead and hit the adjustable button twice. Then I'll hit my 34-inch. And then we'll hit standby. And that completes the lateral transfer and Hovermatt OR training. Thank you.